Hi everyone, welcome to researchmd.com. Another great presentation. My name is Dr. PRAMIL. I'm one of the program director, internal medicine residency, transitional residency. We've been doing series of board review material with a high yield topic. Okay, and we can expect this in any type of questions like internal medicine board, nursing board, and USMLE, and all of those questions. So let's look at what's our clinical scenario. So you will have a patient come with a systolic heart failure with ejection fraction 36%, and they're defined as stage class 2. Anytime when a patient comes with a heart failure, the first thing you have to do is what? You have to define it, systolic heart failure or diastolic heart failure. Okay, that's the first thing we have to do. And the second thing we need to know, if it is systolic, right, we need to know the New York Heart Association classification. Our management is pretty much dependent on that, okay? So I'm going to write up here. The first thing, you just know this is systolic, okay? So, and then we do the New York and Heart Association class 1. We got class 2, class 3, and we got class 4. Okay, so we need to know. When we talk about New York Association class 1, patients are stable, no symptoms, they can do ordinary activities. Remember that. It's nothing normal. You will not find anything. They're doing their routine activities without any problem. When you talk about New York Heart Association class 2, you can have mild symptoms with ordinary activity. Okay, when you move to class 3, you are having moderate symptoms, but you will be at rest, there won't be any symptoms. Okay, now stage 4, what happens, your symptoms start even at rest, you're going to have like shortness of breath and all the symptoms. Okay, that's very important. So the reason for that, our management depends upon how the classification is. Okay, always remember. So the first thing is, you find out either systolic heart failure or diastolic heart failure. So if it is systolic heart failure, you take the step and New York Heart Association classification. So this patient over here, we're talking stage 2. Okay, so we need to know how do you manage stage 2. That's the whole purpose of this. When you talk about managing stage 2, first definitely you have to give a beta blocker. You need angiotensin receptor blocker and neprisilin inhibitor. That's a combination. Okay, Paradigm trial have clearly shown the benefit. So the combination we usually use is valsartan plus sacubitril. Okay, so what are they? Valsartan is your angiotensin receptor blocker, and then you have this new drug called neprisilin inhibitor, sacubitril. You put a combination, studies have shown mortality benefit up to like 40%, huge drop in mortality. And then you can keep the patient out of the hospital too. And then you can use, of course, aspirin, statin. Of course, there's diuretics, mainly for symptomatic, right? We know like we give Lasix and things like that. So this is the question. So most of the time, like if I'm writing a question, I'll say like a stage 2, and one of my answer is going to be ACE inhibitor, because most people, that's the most common wrong answer, is don't pick ACE inhibitor only, okay? That's not the right way. The right answer is you need angiotensin receptor blocker plus neprisilin inhibitor, which is valsartan and sacubitril, instead of the ACE inhibitor, okay? That's it, my friend. We'll be back with another high yield topic soon. God bless.